bad at all. Well, we're giving the spotlight to Utah's chief investigator at the medical examiner's office. This is Dr. Cory Russo. Thank you very much for coming in. And the medical examiner's office is very important for a number of reasons. Of course, you help solve crimes, homicide, and those types of things. But just in a nutshell, let us know what you guys do.
Yeah, so the Office of the Medical Examiner is a statewide medical examiner system, which is very nice. It means we have a lot of experienced and educated staff, and it creates a consistency across the state. And our core tenets of our office are to positively identify decedents, determine cause and manner of death, and certify that cause and manner of death. We also provide expert witness testimony and educate new students coming into the field of forensic medicine. And we also identify threats to public health as well. And the importance of our office, which I think some people may not understand, is that we're not only here to help the people that have died and bring closure to families. That is, very important. But we learn so much about the living from the people that die, whether that be targeted prevention efforts when we're talking about suicides or drug overdose deaths, or whether that be disease and new drug therapies. And, our data really helps public health in general.
Yeah, I guess we learned a lot about the opioid epidemic long before it actually became an epidemic from your office.
Yes. Yeah, and I know, I think Dr. Gray was involved in that, and that was, I've only been at the office for about 4.5 years, but I've just seen amazing improvements in the time that I've been here. And we have internship programs. We did a Kids in Science Day this past summer, which we invited at-risk youth to our area, and we did all types of different booths to teach them about forensic science and medicine.
It's really
and
cool. You mentioned the statewide system, and that's pretty unique.
Yes,
but it's really important.
I guess other states have like coroners,
counties,
they're elected.
Yes, so that's the positive thing about our office is we have board-certified physicians, medical examiners, whereas in some states there are coroners who are elected, and you never know what the qualifications are for those areas. They can vary quite a bit, and so we're very fortunate to have the system that we do.
They all report to your office.
Yes. And and another rare feature of our office is our epidemiology team.
Yeah, that was fascinating to me. Why do you have epidemiologists?
Yeah, so they focus heavily on suicide deaths and drug overdose deaths, and outreach to those families to do very thorough interviews to try to understand triggers, trends, and gather the data behind those types of deaths, which is really important, and offer resources to those families as well.
And we know you're crucial in criminal investigations as well. You talked about having to testify in that thing. Every once in a while, though, we'll say there's a death investigation underway after someone fell at a national park.
Yeah.
Where does it go from there?
So once a death occurs, law enforcement or the hospitals report that death to our office, and we determine if it falls under our jurisdiction. We follow the Medical Examiner Act, which is a state code which says that any death that falls under these specific parameters will fall under our jurisdiction. Once it falls under our jurisdiction, then we go to the scene, we do a full investigation of the scene, the decedent. We're focused on, the medical history, psych history, all types of things that go into this.
Okay, a final question here. How does your service help everyone? I guess in death, that helps the rest of us, some of the things you find out.
Yeah. So, that is what our office is for, is to help the living and to bring closure to families. But we work with agencies all over the world, really, to do research and to help figure out how can we prevent certain types of deaths. and how can we treat certain diseases even. And so our data is very important.
Crucial to working together with other agencies as well to come up with solutions.
Yes,
right.
definitely.
Yeah, that's fascinating. I'm glad we were able to dig into this and find out a little bit more. So
yeah.
Well, thanks so much for coming in.
You guys to learn more about what we do. And
yeah.
Well, Dr. Russo, thanks so much.
Thank you.
And we'll talk again sometime.
Okay.
All right. Appreciate it.
Sounds good. Thank you.